Welcome back to Light O'Clock, the podcast where we explore how light exposure and circadian rhythms shape our health. In our previous seasons, we have talked a lot about the circadian system and how our body works across the 24 hours. In this new season, we're taking this one step further and asking, what does all of this mean for medicine? We will explore how biological timing might help improve prevention, diagnosis and treatment, from vaccines and immune responses to cancer care, metabolism, exercise, neonatal health, and shift work. And to start this season, we're tackling some of the foundations. What do we even mean by circadian medicine? How can medicine use the body clock? And what needs to happen before these ideas can become part of everyday clinical practice? And for this introductory crash course in circadian medicine, I chatted with Henrik Oster.
Thanks for having me. Yeah, my name is Henrik Oster. I'm a biochemist by training, but since more than 20 years working in circadian clocks and rhythms. And I'm heading the Institute of Neurobiology here at the University of Lübeck in northern Germany.
And today with you, we are taking a big tour through the world of circadian medicine. And we will also touch on several topics that we will return to throughout this season. And so before we discuss why timing matters in medicine, let's first get everyone on the same page about circadian biology. What do we mean by biological timing, and how does our body time different biological functions?
Yeah, I mean, biological timing can mean many things, but when we talk about biological timing, we usually mean that our bodies adjust according to the time of day. So different demands on our organism that are imposed by environmental changes are kind of adapted to by our physiology. And this is a very fundamental process that is driven and coordinated by molecular clocks that sit in each of our cells, and in a coordinated fashion then drive how the cellular and then tissue functions and ultimately systemic, like body functions, are coordinated across the day.
All right. And so you said that each of our cells in the body, they have like a clock that operates across 24 hours. How do they stay in sync with each other? Is there something that coordinates them so that they're all having the same timing?
Yeah, that's actually a good question that is not entirely answered yet. I mean, we have a master clock in the brain and in the hypothalamus, in the so-called suprachiasmatic nucleus, that is important to coordinate all these different clocks across the body. We know a few factors how it does so. So first of all, it's a bunch of neurons, so there's neuronal activity, but from that there's secretion of peptides and ultimately control of the autonomic nervous system and endocrine factors. Think of cortisol or melatonin, factors that are very rhythmic. And these together are sensed by cells outside of the SCN, outside of the brain, and help them to kind of adjust their internal timing so that ideally all the clocks in the body show the same time. And this internal time is then also kind of coordinated with the outside light-dark cycle principally. And that's also how the SCN receives its information from the environment. But how exactly this coordination is done for specific type of cells, which factors are essential, which are kind of modulatory, is not very well understood yet. We can take away the melatonin or we can take away the cortisol, and still a lot of rhythms persist. So there's some redundancy, and there's probably also some kind of specificity with regard to specific organs and how they're coordinated.
Right. So you're saying basically we have this circadian master clock, which sits in the brain, this suprachiasmatic nucleus, receives information from the outside world about the light and dark cycle and syncs to this cycle. And then in turn, it sends signals to the body to coordinate all of these little cells and all of their body clocks.
Yeah, exactly.
And so this is kind of what we understand so far, but we don't really know exactly how this works, you said. And so going back to some of these rhythms that we observe, you mentioned melatonin, you also mentioned cortisol. Can you give us other examples of, let's say, physiological or behavioral functions that have this circadian rhythm, so this fluctuation across 24 hours?
I mean, the most obvious circadian rhythm that we have is our sleep-wake cycle. I mean, if you talk to people about internal clocks, then what comes to our minds is that we sleep or should usually sleep during the night and should not, or very little sleep during the day. Along with that, I mentioned the autonomic nervous system. So that's also coordinated through the circadian system. We have body temperature, we have metabolism. So when we are hungry, when we digest, and how energy is then kind of distributed across the body, how it's used. So activity, basically more or less the whole endocrine system is regulated to some extent by the circadian clock. There are hormones that are very rhythmic, like melatonin or cortisol. There are others that are kind of more modestly rhythmic, like the thyroid, for example. But if you look close enough, then you will find some time of day variation in most endocrine factors. So that's pretty pervasive. Most functions in the body to some extent show some regulation across the day.
And what happens when we have kind of a desynchrony in this rhythm? So let's say a desynchrony either in how the internal clock, so my own circadian rhythm, and the external clock, so the light and dark cycle. If there's a desynchrony there, what happens? And also what happens if there's a desynchrony in the internal rhythms? So you said there's like a lot of different clocks in the body, so they might also not be synchronized, right?
Yeah, that's very interesting. So the first case that you made, when internal and external time are out of sync, this is what we call jet lag. So if you go on a vacation into a country which sits in a different time zone, then your internal clock is basically lagging behind. So you arrive in an environment where the external light-dark cycle is out of sync with your internal time. And what you experience is problems with falling asleep or waking up. Your appetite rhythms are deregulated, and you generally feel kind of less efficient in functioning. It may kind of cause some bad moods. You have difficulties making decisions. But the good news is, because the internal time can adapt, it takes a couple of days for the clock to catch up, and then you're back in sync and everything's fine. Now, the second scenario where you have like what we call internal desynchrony. So your brain clock might be out of sync with your intestinal clock or your clock of the immune system. And that's a bit more complicated. And it's also something that may last. And so it's probably one of the issues that we have in shift workers. So in people that at least for some time have to be active at times when their body clock tells them to sleep, to rest. So that means that a lot of environmental influences become kind of disrupted. We have light at the wrong time. We probably eat at the wrong time. We are active at the wrong time. We sleep less well. And that most likely leads to a kind of incoherence of the rhythms that we have in the different tissues. But this scenario is still kind of very poorly understood, because it's very difficult to assess all these clocks at the same time in an acting organism, or even in humans where we have limited access to specific tissues. But that most likely means that then the different kind of organ functions are not very well coordinated. And while that doesn't kill you straight away, it makes you less resilient to other external kind of insults. So if you are at risk of developing a metabolic disorder, and then you come in a situation where your internal clocks are perturbed and desynchronized, it makes you just kind of push you over the border, really. And so it just increases your risk of your vulnerability to influences from the outside, pathogenic conditions. It may affect your immune system. Something that's very common in people that come from intercontinental flights is that they catch a cold. I mean, it's one hand, you sit together with so many people in the airplane, but it is also the circadian disruption that you experience that compromises your immune defenses and makes you just more likely to catch a cold.
All right. So now that we have covered, let's say, how the circadian system works and also what happens when we have circadian desynchrony or circadian disruption, let's turn back to the idea of circadian medicine. So we bring the idea of medicine in the circadian. What do we actually mean by circadian medicine?
Yeah, we mean several things by that. I mean, the first approach would be what we've just been discussing, trying to kind of rectify, to stabilize, to improve circadian coordination across the body in order to increase resilience. So that does not necessarily mean that that person needs to be sick to start with. It may just mean that we want to prevent disease development in a condition where we might be vulnerable. So that could be means like behavioral therapy. It could be light therapy to kind of directly address the master clock. It could maybe even be drugs that kind of explicitly or specifically target the molecular clockwork. I mean, these are things that we don't have yet. We have some substances that do that job, but they are not in clinical practice yet. On the other hand, we may use our knowledge about the circadian system to improve medical therapies and treatments that we already have. So it might make a difference, and in many cases it does, if we give a drug in the morning or we give a drug in the evening because our body is in a different state. This may be an issue of the disease, which may show rhythms. If you think of, for example, allergic asthma, usually has the strongest symptoms in the early night. So it might be better to apply the drugs that you take in the evening. It may also mean that the disease itself is not so critically depending on the time of the treatment, but it's actually the healthy environment, the body. And a good example is chemotherapy. So in many tumors, the circadian clock itself is disrupted. And so the tumor doesn't care when the chemotherapeutic agent reaches the tumor cell, but the surrounding healthy cells may well do. And so it may make a difference if you take a certain chemotherapeutic drug in the morning or in the evening, not so much for the effect on the tumor, but how you actually cope with the treatment, with the side effects. So kind of optimizing that ratio between action and side effects, that's an important aspect of circadian medicine.
Just to jump in there. So basically you're saying the two strategies that you've described so far are, one is, okay, let's actually target the clock. So let's actually use this knowledge that we have about circadian rhythms and kind of strengthen the circadian rhythm or the circadian system by, for example, even simple behavioral interventions like timing, I guess, your meals, your exercise. When do you receive light, meaning light not at night, but during the day, especially in the morning, and having a regular sleep-wake schedule. So this is kind of one approach that you described about circadian medicine targeting the clock. And then what you just described is more like using the clock to optimize, as you said, the treatments that we already have, or maybe minimizing the side effects. So timing the delivery of a specific drug. You mentioned asthma, but also, for example, chemotherapy. And there it would be kind of minimizing the side effects depending on the time of the day that you deliver the drug.
Yeah, exactly. And the final approach would be to use the kind of individual's clock mechanism to kind of individualize the treatment. So I mentioned the asthma and chemotherapy. So it might actually mean that because individually we have different clocks, we have the same machinery, but kind of how it's acting across the day may differ. I mean, we call these chronotypes. So you're like early persons or late persons. It's a bit of a simplification because we have so many clocks. It might be more complicated than that, but it would be interesting to know in a given patient or a person at risk how the individual clock is ticking to kind of tailor the schedule of treatment. So a person that's an early morning chronotype would suffer more tremendously from a late work schedule than somebody who's late to start with. On the other hand, if we think of chemotherapy, in a very late person, the early morning might not be the best time of treatment, but maybe the late morning or the early afternoon. So kind of optimizing this kind of second approach of using clock function as a timer or a determining factor for the timing of the treatment, but then on an individual level. So that would mean that we would need to develop good means of actually measuring the clock function, maybe even the multiple clock function in a human.
Yeah, exactly. So because we were discussing this idea that really we want to target the clock or maybe use it to optimize the treatment. And then, of course, the question is, how do we detect it? How do we know the circadian timing of a specific person? What are the approaches that we can use at the moment? What do we have?
I mean, the classic approach is questionnaires where you basically try to find out how the circadian rhythm in an individual person is phased relative to external time. So you ask about sleep schedules, or when are you active? Do you feel tired in the early afternoon or in the late afternoon? So things to kind of narrow down on a specific phase that you could mark as kind of the determining phase of the body. Now, you can do this a little bit more objectively by studying some of these rhythmic factors that we have. I mentioned melatonin, so kind of the gold standard for measuring chronotype is the so-called dim light melatonin onset. So you bring people into the sleep lab, you put them under dim light conditions because the light itself influences the melatonin secretion. And then you measure the time in the evening when melatonin goes up. And this kind of initiation of the melatonin on phase, if you want, is a good measure for your central circadian clock.
And so it would be that for someone who's what we call an early chronotype, the melatonin starts to rise earlier than for someone who's a late chronotype. In that case, we would see the melatonin later on.
Yeah, exactly. I mean, roughly the questionnaire data and the DILMOS or the dim light melatonin data correlate, but in any individual case, they might differ quite dramatically. And this may be because of a kind of a misconception about your own sleep times. It may be that you have extremely short sleep times. So you think you're a late sleep type, but in fact, you're only a short sleep type. Or it may be something different that we don't know yet how to explain. On the other hand, also the melatonin rhythm does not very well cover all these peripheral rhythms that we also have. And so more recently, there have been approaches to look at this from a more genetic level. So basically looking at these genes that are rhythmically activated in different tissues. And because in humans, it's a bit difficult to get at internal organs. So you do this from blood, so cells, immune cells in the blood, or you can do this from hair follicles. So you kind of pull out a few hairs and then you have a few cells around these, and then you can look at these cells. These are still assays that are under development, but may allow on a larger scale to get a little bit more of a systemic readout of the phasing of the internal system. But I can already foresee that the closer we look, the more complex this will be. So we will probably get people that have a late liver clock, but an early kidney clock or something like this.
Yeah.
And then it's going to be interesting to see how we can kind of tailor any circadian medicine approach to benefit that particular situation.
Right, I see. So you're saying, for example, in this genetic approach, basically looking at the rhythmicity of certain genes using hair follicles or looking at cells in the blood, we can kind of avoid the situations where we have to bring people in the lab and measure melatonin, which I can imagine is also quite, it's not a very efficient method to understand the circadian timing of thousands of individuals, right?
Exactly. I mean, it's absolutely impossible to look at large cohorts of patients in a way that you invite them one by one into the sleep lab, put them in dim light and repetitively sample saliva or even blood to measure the melatonin levels. So what you want is something that you ideally can determine from the kind of samples that you take during routine medical checks already. So a simple blood draw or pulling out a few hairs when the patient shows up and then you're noting the time. And that is something that is possible now, that by noting the time when the sample was taken and then measuring several genes, comparing the activity of these genes against each other, and then you can kind of home in and estimate roughly what the kind of internal phase of this particular tissue that you're looking at would be. And assuming that blood cells are a good indicator of the general chronotype, you can then make some recommendations, for example, for the timing of medications or for the state of the system, how disrupted it may be or how it would need resetting to increase resilience.
Right. And so these methods that we just discussed, they sound very, let's say, biological or like molecular. So we really want to get like a biological sample to understand the clock. Earlier, we also mentioned that, for example, one very obvious rhythmic function that we have as humans is our sleep-wake cycle. And so I was wondering, can we use methods that are not, let's say, invasive or not necessarily biological in a molecular sense? Can we, for example, use like wearables to detect the circadian clock?
Yeah. Yeah, I mean, obviously, that's also a way of describing the phasing of circadian rhythms, such as the sleep-wake cycle or physical activity, or even things like body temperature or blood pressure in an individual without needing to bring them to the hospital or so. It's a bit complicated because, I mean, these rhythms are then determined under certain environmental conditions. And that's obviously something that needs to be taken into consideration. But these approaches, I think, are very well suited to detect disruption. So changes in the rhythms that may occur, for example, when diseases develop. For example, in many psychiatric diseases, we see, think of bipolar, for example. Bipolar depression, we have patients in different phases. We have manic phases, we have depressive phases. And often these shifts between these states are marked by changes in the sleep-wake rhythm, in the activity rhythms of these patients. And maybe at some point we would even get something like an early detection system where people using some variables to kind of monitor their circadian rhythms would kind of be warned that they could be entering in a specific phase. And maybe one could even prevent or at least kind of counteract the expression of that particular phase. I mean, but that's true for many other diseases and also immunological diseases as well. So it's maybe not the same as determining the chronotype as a specific phase marker. But on the other hand, it offers potentially more insight because the readout is more complex. And we can look at different parameters. We can look at sleep length, at sleep consolidation. We could look at amplitude of temperature, these type of things that are so much more than a simple phase marker, a simple timestamp that says, okay, early, late chronotype. Yeah, so this is very promising. Yeah.
Yeah, okay. I see. I definitely think with the technological developments as well, we can use more and more these kind of wearables to get these kind of data.
Yeah.
And so, these approaches that we describe, using the clock to improve treatment, prevention even of diseases, and also kind of targeting the clock as a strategy in medicine, they sound very promising. And they fit well this idea of what you were describing earlier of precision medicine or individualized medicine, where, for example, we really consider the patient's lifestyle and family history and disease history before, for example, prescribing a medication. This also sounds at the same time very promising, but also very complicated to actually put into practice, right?
Yeah. Yeah.
For example, in a busy hospital where there's already so many things that the doctors have to take care of. I guess my first question on this would be, do we have examples of circadian-based approaches that are already used in routine clinical practice?
I mean, there are a few approaches that have been around for a relatively long time. Maybe easiest are things like light therapy in affective disorders, particular seasonally affective disorders, where patients basically are exposed to relatively bright light in the morning as a means of stabilizing their circadian internal rhythms. Or things like sleep hygiene programs where patients are trained to kind of normalize and stabilize their circadian organization. Let's put it in that way. You mentioned like when they eat, when they sleep, how they use light sources, electronic media, in order to kind of stabilize and their circadian system, and with that also affect potential disease states. There's other examples where there's recommendations for at which time of day drugs to be taken, like statins, for example, so lipid-lowering drugs for cardiovascular diseases. Lowering cholesterol levels are most efficient if they're taken in the evening, because during the night we have kind of circadian rise of our blood lipid levels. And then if they counteract that peak, then that's most efficient mode of action. There's also some, so for example, patients that suffer from adrenal insufficiency and have to take glucocorticoids to substitute for the natural cortisol secretion. So cortisol is highest in the morning, and that makes a bit of a problem for these people, because they have to get up in the morning, they have to take the drug, but sometimes the symptoms that they have from the low cortisol levels are also highest in the morning. So in order to become active during the day, it's actually good if you have a higher cortisol level, but you can only get this when you're already gotten up and taken the drug. So drugs have been developed that you can actually take in the evening, but then they are not released for some time. And then the drug levels go up only in the early morning before you actually wake up, so that when you wake up, you're already at an elevated cortisol or glucocorticoid level. That's also interesting for diseases like rheumatoid arthritis, where you also use glucocorticoids to suppress some of these immune functions and the stiffness of the joints and some of the pain that they have. This is something that's most prevalent in the morning, and the patients benefit tremendously from the fact that cortisol or the glucocorticoid, the synthetic glucocorticoid levels go up with a drug that they've taken in the evening before they actually wake up in the morning. So the stiffness is much better. So there's a few examples for this. But in many cases, it's also something that has to be coordinated with, established procedures in the hospital. Just an example, I mean, some years ago, we were thinking about conducting a study on a specific chemotherapeutic therapy. And so we went to our oncologists and we asked them whether we could look at patients that received the treatment in the morning versus the afternoon. But it turned out they don't even have any patients in the afternoon, because that's when the ambulance for the chemotherapy, where people kind of walk in to receive their treatment, is already closed. And it would have been hiring new staff to actually enable that type of study. So at this particular drug, we still don't know if it would be better to have it in the afternoon.
Yeah.
And that's true for many cases. So it's also another example where circadian, well, let's not call it medicine. So what I'm talking about is teenagers. So in teenagers, the clock is on average much delayed. So they become like late types naturally. But school still starts very early. So it would be better for the kids if the school, at least in the later stages of high school, would start a little bit later, maybe an hour or maybe even 2. But that causes logistic problems to families that have also younger kids, and to public transport that usually stop running the regular buses sometime after 8:30 or so. And a compromise needs to be found here. And that's not something that a chronobiologist can decide. So that needs many people to sit together and find a solution.
Yeah, definitely. So you're saying like the barriers here are mostly really structural barriers, and sometimes just logistically impossible even to know if a drug is more effective in the morning or in the afternoon, because we just cannot conduct the studies that would allow us to know what is more effective. Yeah, I understand. This is very, very interesting, especially in the hospital setting as well, where there's just a lot going on. And I guess to wrap up, I would be interested to know, in your perspective, in your opinion, what is the future of circadian medicine? And maybe this is a big question, so we can think of what are the next steps that we can take to kind of make this more of a reality.
I think the most important aspect of circadian medicine is the very simple approach of stabilizing circadian rhythms, because this is something that is important not only for specific diseases, for very specific types of patients, but it's something that applies to all of us. We are all living in a more or less chronodisruptive environment. We have artificial light at the wrong times. We are active at times that are maybe not ideal. We are stressed, and the stress axis interacts with the circadian system very directly. And to help us maintain a stable circadian rhythm in such an environment that we will also not be able to change very easily, I think that is something that's going to be a very important aspect that applies to many, if not all of us. The other thing that will be important is definitely the kind of characterization of internal rhythms. So not only determining chronotype on a large scale, but understand what is going on in shift workers. Where is the problem? Is it the liver? Which is the tissue or the tissue clock to target? I think that's something where we still need better tools to understand what's going on. And this will then enable a more specific, more targeted approach in that area where we say, okay, give the drug now. And I think that's very important, because it may mean that with a lot of the agents, the drugs that we have on the market right now, we could do better without needing to develop for a lot of money and a long time new substances, but really work with a lot of the things that we already have. But there's challenges, and to understand how specific environmental factors interact with the circadian internal clock system and how this system is then disrupted or acting on disease development. I think that's where the future is.
Right. So if I understand correctly, you're saying we can already use some tools of circadian medicine. All of us can do it. And this is the beauty of it, I guess. We don't necessarily need a doctor. We can just already start to align our sleep-wake schedule. We can try to avoid light at night. And to the best that we can do, because sometimes it's also hard. As you said, we live in a chrono-disruptive environment.
Yeah.
But then we also need a little bit more of understanding the mechanism. So like, let's say basic science on how these rhythms work. How do we detect them even? To then translate this to treatments and prevention and diagnosis of diseases for circadian medicine.
Exactly.
Great. Thanks for giving us your perspective as well.
Thanks.
And with this, it's been a pleasure to speak to you. And thanks for coming on the podcast and sharing your insights with us.
Yeah, thanks for having me. Bye-bye.
So that was my conversation with Henrik. And here's a brief summary of this crash course into circadian medicine. So we discussed that applying circadian principles in medicine can mean different things. One approach is to target the clock, the circadian clock. And that means strengthening the circadian system, and it really becomes part of the treatment target. And that might mean things like timing exercise correctly, timing light exposure correctly, so more light in the morning, less light at night, keeping a regular sleep-wake schedule, and also using light therapy for some mood disorders, for example. The second approach that we discussed was exploiting or using the body clock, the circadian clock. So that means using the clock to optimize when to deliver a given intervention. So we discussed here timing of medication to maximize the efficiency of the medication or even minimize the side effects of a specific chemotherapeutic medication, for example. And the final approach that we discussed was how to personalize the treatment based on circadian principles. In other words, administering the treatment at a time that makes the most sense for the patient's circadian clock. And to do this, we actually need to be able to detect the person's circadian clock. Nowadays, we're still mostly relying on time-consuming lab studies, but new methods using samples of hair or looking at blood cells are being developed. And also wearable devices like smartwatches, which measure the sleep and activity rhythms, might be able to help detect patterns that can predict a certain relapse or a certain symptom in a large cohort of individuals. And that's it for today. I'm so excited to learn more about the topics in this season. And to give a little teaser already, in the next episode, we will be asking, are vaccines more effective at a specific time of the day? I'm really looking forward to that episode. All right, I hope you enjoyed, and I'll catch you next time in around a month. Bye! You have been listening to Light O'Clock. This podcast is produced by me, Caro Guidolin, a PhD student of the Translational Sensory and Circadian Neuroscience Unit. Music, mix, and sound design are by Ingo Bednarek. We are supported by the Max Planck Institute for Biological Cybernetics and the Technical University of Munich.